Hi, everyone. We are members of UCLA Interaxon, and today we are here to talk to all of you about a very important topic drugs. This is a presentation that is only for educational purposes, and we are only here to inform you about the common types of drugs. You can make your own decisions using this information and make the safest and healthiest decisions for you. So, can anyone tell me what they already know about drugs? Take a moment to pause the video and think about it. The three main things that people usually know about drugs are that number one, they change the way that your body works and a person's body and mind work. Number two, they're illegal and legal drugs. Legal types are probably the ones that you can get from your doctor, but illegal types are ones that are illegal by the government and are not allowed. Number three, there are two main categories of drugs called stimulants and depressants. The first type of drug we will talk about are stimulants. Stimulants work by speeding up the central nervous system and increasing nervous activity and activating a physiological response in our body that makes all of our body functions work a little bit faster. Taking stimulants for a short period of time is known to increase your bodily function, like alertness and heart rate. Unfortunately, taking stimulants over a long period of time, like coffee or cigarettes, can actually lead to anxiety, stress, and addiction. These pictures show very common stimulants that you might know about, which I mentioned caffeine, cigarettes, and steroids. You may be surprised to hear that coffee is considered a drug, but that is because coffee actually contains caffeine, and caffeine is a stimulant. Why do you think caffeine is a drug? Do you have a friend or family member that drinks caffeine regularly? Think about the ways in which caffeine could affect their body.
Another category of drugs is depressants. Depressants do the opposite of stimulants. They slow down the central nervous system and create a sedative physiological response. In the short term, taking depressants decreases bodily function by lowering heart rate and breathing and can impair judgment. In the long term, taking depressants has been linked to addiction, sleeping problems, and even death. As you can see, some common depressants are alcohol and opioid pills. Alcohol is also called ethanol. Depressants promote the activity of a neurotransmitter called GABA. One common depressant that can be very harmful are opioid pills. Opioids are strong pain relieving medications that are only available by prescription, like narcotics, Vicodin, and Oxycontin. They are generally safe when taken over a short period of time when correctly prescribed by a doctor and not abused. Opioids act on what are called opioid receptors in the reward system of the brain. Opioid receptors are responsible for endorphins that regulate pain and emotion. They can produce a pleasant feeling called euphoria and reduce pain.
Now, with drugs, there is a danger of becoming addicted, which is different from being dependent. What do you think the differences might be? When dependent on drugs, patient might be taking the drug for chronic pain or diseases, and the drug is needed for the patient to live a normal life and function more normally. When addicted to drugs, however, patient may become isolated from the people in their life, and they might be using the drug to avoid normal daily interactions. Overall, addiction to drugs can affect the patient and the people in the patient's life very negatively. There are different warning signs of addiction. Some of these include taking medications more frequently than what is prescribed or what the doctor has told you to do, ingesting the drugs in other ways than how it is prescribed, like snorting, injecting, or crushing it, telling your doctors that you lost the drugs in order to get extra, and finally, receiving the drugs from more than one doctor or pharmacy in order to get more drugs.
Now, we will talk about some specific drugs that people use and their effects. The first one is meth. Meth is a very addictive and illegal stimulant drug. Remember that this means that it speeds up the neurotransmitters in the brain and it increases bodily functions like alertness and heart rate in the short term. Meth has no distinct color or smell, and it is shown here as this white powder. When a person takes meth, it causes their brain to feel like it's in hyperspeed. In addition to having your heart rate increase, you can sweat a lot or breathe very quickly. It can also lead to severe conditions like seizures, heart attacks, paranoia, and death. Here are some examples of more symptoms that could occur. As I mentioned earlier, meth is highly addictive, and in the long term, it can be extremely harmful. These photos show what meth can do to a person. If you are disturbed by these images, you can look away, but these are some images that show what meth can do. It can cause your teeth to rot, your skin to look aged and have sores, and the worst part is that it causes long term brain damage.
The next drug we're going to discuss is Adderall. And this is another stimulant drug that is similar to meth. Adderall is a drug used to treat conditions like attention deficit hyperactivity disorder and narcolepsy. There are many misconceptions that exist about this drug. One of them is that Adderall makes you smarter. Even though Adderall makes a person feel more focused, it will not raise your grades. In fact, people who have used Adderall when they have not been prescribed it tend to have lower GPAs. Another misconception is that Adderall is safer because doctors prescribe it. However, there are many dangerous side effects of Adderall. Adderall side effects include headaches, jitteriness, insomnia, nausea, and seizures. There are even increased risks of having a heart attack, stroke, or liver failure when using Adderall. Sometimes it may even trigger mania, or a state of mental illness marked by periods of great excitement or euphoria, delusions, and overactivity that could even result in psychiatric hospitalization. Now we're going to watch this short video on Adderall and how it affects the brain.
Adderall is the brand name for a mixture of amphetamine salts that was developed for treatment of attention deficit hyperactivity disorder, aka ADHD. Since 2007, prescriptions have doubled in the US, and even those who don't have a prescription are using. An estimated 30% of university students use Adderall at some point as a study enhancer. But what happens to your brain on Adderall? Adderall is a combination of amphetamine salts, and therefore is, yup, a close relative of methamphetamine, commonly known as meth. When Adderall is ingested, it takes effect on the brain within an hour of use. Adderall affects neuroreceptors in the central nervous system, increasing the effect of serotonin and dopamine. In patients with ADHD, genetic studies have indicated that these individuals may have dysfunctional dopamine release.
Let's talk about marijuana now. Marijuana is a shredded green or brown mix of dried flowers from the plant cannabis, and it is usually smoked. Recently, it has become increasingly popular for people to inhale marijuana or stronger marijuana extracts using a vaporizer called vaping or dapping. Some people mix it into food or brew as a tea as well, and they are called edibles. There are many short-term effects of using marijuana. The first one is the main active chemical in marijuana is THC. When someone smokes marijuana, THC goes in from the lung into the bloodstream. From there, it ends up in the brain and other organs. High results from THC effects on the nerve cells that control sensory perception and pleasures. Some of these side effects include trouble thinking and problem solving, problems with memory and learning, and loss of coordination and distorted perception. These side effects are temporary, but they can make it dangerous to do things like driving while under the influence of marijuana. People also might notice other short-term side effects of using marijuana, such as an increase in appetite and feeling lightheadedness and drowsy. There are also other long-term effects of marijuana. First, it creates changes in your brain. The THC in marijuana can affect part of the brains that play a role in our ability to remember, multitask, and pay attention. It can also causes respiratory system problem. People who smoke marijuana a lot can develop problem with the respiratory system, like more mucus, chronic coughing, and bronchitis. Regardless of these effects and how they affect the brain long term, it is important to know that there are a lot of people that do use marijuana for medical purposes. And for some diseases, doctors are allowed to prescribe marijuana as a treatment. It is important to respect their choice of marijuana as treatment and as well as their doctor's choice. So just a little bit more insight on medical use of marijuana. The US FDA has approved pills containing THC and other cannabinoids like CBD as a way to help relieve pain, nausea, muscle stiffness, and other problems with movement and chronic pain, Alzheimer's disease, cancer, epilepsy, and it is taken in very, very small doses. And the main reason for medical marijuana is that it might relieve muscle stiffness, control nausea, and stimulate appetite. THC and other cannabinoids are also available in some states and requires doctor's prescription. At the moment, there is not enough research at all to say that for sure if smoking marijuana is any more helpful than taking THC or other cannabinoids as a pill alone. Scientists are still studying this.
Next up, we're going to be talking about inhalants. Inhalants are toxic vapors that are inhaled to slow down the activity of your nervous system and produce a high in your brain. They're absorbed through your lungs and they go directly into the bloodstream, and this can make them very potent and very dangerous. There are more than 14,000 types of inhalants that people can use, and things like paint thinners, which we'll talk about, are some of them. Common types of inhalants include liquids, sprays, gases, nitrites, hairspray, paint thinners, glue, shoe polish, and permanent markers. Can you think of some places where you would use inhalants? Maybe in your classroom while working with permanent markers or paint thinners. That's why it is important to use these things safely and be aware of the type of things that can happen to your body. Next, let's talk about the symptoms of inhalants. Things can happen such as asphyxiation, which is death or loss of consciousness from impaired breathing from inhaling these things. Next, there can be numbness, which is a loss of sensation. And third of all, there can be a sudden sniffing death, which is heart failure caused by heart stress or startle with these inhalants. These things can happen after just one use of an inhalant, and the heart gets very sensitive after inhaling this item.
Next, we'll be talking about alcohol. What do you guys think alcohol is? Well, it's actually a drug. Alcoholic beverages can be made from many sources, like fermented wheat, grains, and carbohydrates, and they are very high in calories. Have you heard of the term beer belly? That is where it comes from. As we see from the different drinks here, there are lots of different types of alcoholic drinks that can have differing contexts of alcoholic volumes in each one. This is called ABV, or alcohol by volume. Alcohol can be very detrimental to your brain, and we're going to start talking about the cerebral cortex. The cerebral cortex is responsible for information processing, and this is hindered by the drug. When someone is driving, the police could pull them over if they are suspected of having alcohol in their system, and they are required to say their ABCs backwards and do certain tests to test their reaction time to make sure they are able to drive. It is extremely dangerous to drive while intoxicated, and if you can't think quickly, then you cannot react when driving. Coffee can help in reducing this reaction time, but it will not get alcohol out of your system, and you should still not drive if you've been drinking. Alcohol can also affect another part of the brain called the cerebellum. The cerebellum is known as the little brain and is responsible for your balance. Often the police will try to make someone walk in a straight line in order to test this. We can see this man struggling in the little picture down here, trying to balance on the line that is set up by the police. If he has been drinking, he may not be able to walk in a straight line. Intaking alcohol can also slow down a part of the brain called the medulla, and we can see the medulla in the picture below near the base of your brain. It's part of the brainstem. The medulla is responsible for functions like breathing and things we don't often have to think about doing. This means they are involuntary. When the medulla slows down, the alcohol can slow down your medulla's functions to a dangerous level. Pause and think. Would you ever want to ingest something that could lead to such detrimental effects?
Now, we're going to watch a video of how a person acts when they're intoxicated and when they've drank alcohol versus not drinking alcohol. We will just watch a small portion of it, and you can watch the rest on your own.
Which code am I going through? I'm the lead facilitator for Ford's Deriving Skills for Life program. It's not like traditional driver's ed. This is more a process of making teens aware of the repercussions of certain actions on the road. It uses a series of weights. Then there are restrictive areas on the elbows and on the knees.
All right, so I have a confession. I've never been drunk before.
Thank you guys so much for tuning in and listening to our presentation. We hope you learned more about drugs and how they impact the brain. Please check us out on our YouTube channel, Interaxon at UCLA. Thanks!